A common question I get, and it's a common question, is Dr. Harrison, I have implants. Most commonly I get this in the question of breast implants. And is it a problem? Is it dangerous? I think it might be causing a problem. Well, the short answer is yes, they can be dangerous, and no, they probably won't be dangerous. I know that's very vague, but in this video, I'm going to explain how breast implants and other implants can cause problems and what you can do about it and how you can identify if it's really a problem or not. And we're gonna get started right now. Well, hello everybody, I'm Dr. Glenn Harrison and welcome to this week's segment of Why. This is where we take just a few minutes to answer some of the most common health-related questions that I see in my office every day. And if this is the first time you're on the channel and you want to learn more health-related strategies, natural health-related strategies, make sure you click the like button, hit the bell notification, and the subscribe button, because over the weeks and the months, we're going to be answering more and more questions and sending you more and more content you're not going to want to miss. So the question that we're talking about today are breast implants a problem? Do they cause problems? And any implant, because you could replace breast implants with almost any implants, surgical implants, do they cause problems? And is there something I should be concerned about, maybe regarding autoimmunity? Because there's a lot of more research around autoimmunity in breast implants. And will breast implants turn on an autoimmune condition? And the short answer is yes and no. So what do I mean by yes? Well, anything you add to the body, absolutely anything, if it is foreign and abnormal, the body will react. It's not going to like that. And if it reacts, it can irritate your immune system enough. Your immune system starts fighting the implant or the whatever implant that's in your body, and you can turn on autoimmune disorders. Some of these disorders are very, very bad. Like I've seen MS turned on from breast implants. I have seen, or correlated with the onset of MS, I should say that, not guaranteed, but the timing was right. I've seen lung disorders. I've seen autoimmune liver disorders. I've seen so much. Celiac disease, Crohn's disease, thyroid disorders, polycystic ovarian syndrome, endometriosis, and there's a whole host of autoimmune conditions. So foreign entities in the body, including implants, can do this. So the next question is, Dr. Harrison, should I be worried? Do I have to remove them? What can I do? Well, not so fast. The first thing to know about implants is they are usually designed to be innate. I shouldn't necessarily say innate, but they shouldn't irritate the body. They're sealed. The first thing to know, your risk will be, I guess I should say, anybody with implants of any kind, any foreign entity is at risk. But your risk goes up much higher when there's, of course, something leaking in the implant. And breast implants can leak. So you want to make sure, first and foremost, you don't have expired implants. That is a big problem. And a lot of women have expired implants and they kind of forget about them or ignore that expiry date. No, it's there for a reason. You should never maintain implants in your body that are expired. Have them removed or have them changed. Okay, so that's number one. That would increase your risk. The reason why expired implants will increase your risk is because they haven't been tested past that time and they tend to fail after that. They can leak. Now, if an implant leaks, you're taking a chemical that was in the implant that was supposed to be stable as long as it's sealed up. Once it exposes to the body, the risk of developing autoimmunity and health disorders skyrockets. So that's why it's important to make sure your implants aren't expired. So that would bring up the higher risk. So another question I get, well, Dr. Harrison, I have these implants, they're not expired, or I have these implants and now I'm having these bizarre symptoms, or I've been diagnosed with an autoimmune condition. Are the implants part of the story? They can be, and this is where testing is the only way through this. Get tested. In fact, we have tests that are specific. Now, this is a very special test. You probably won't go to your medical doctor and find it. But we'll have tests specifically to see if your body is reacting to that implant and the materials in that implant. If it is, that means it's irritating your immune system and it's aggravating your autoimmune condition, or not necessarily only aggravating, it can cause it. So we want to keep immune irritation away from the body, and implants can be a trigger. So hopefully this was helpful. If you have any questions, I know some people, they have these implants and they're concerned. Well, reach out to us. We can answer your questions and we can point you in the right direction. So hopefully this was helpful. If I have any questions, again, or put comments below, give us a call. All of our information is down below. And I look forward to talking to you next day to answer the why to another health-related question. Have a great day.